Endometrial cancer. This short video will aim to provide you with additional information for women and their families who are diagnosed with or suspected of having an endometrial cancer, a cancer of the lining of the womb. What is endometrial cancer? Endometrial cancer originates from the glandular cells in the lining of the womb. The womb is a pear-shaped organ where a baby is carried during pregnancy. It sits low in the pelvis between the hips and is supported by the pelvic floor muscles. There are many different types of endometrial cancers. Endometrial cancer is usually diagnosed early and treated successfully. Endometrial cancer may be referred to as the womb, uterine or corpus cancer. These all mean the same thing. How common is it? In the UK, about 9,200 women are diagnosed with womb cancer each year. It is rare in women under the age of 40 and becomes more common after the age of 55. What are the signs and symptoms? Usually the first sign of womb cancer is unusual vaginal bleeding. For example, this could be bleeding after the menopause. This is the most common symptom. Bleeding between periods, heavier periods than usual if you have not been through the menopause. A bloody or pink watery vaginal discharge. Less common symptoms are pain or discomfort in the pelvic area or pain during sex. How is endometrial cancer diagnosed? If you've experienced any irregular bleeding, then your nurse or doctor may arrange an ultrasound scan for you. This scan looks at the lining of the womb, the endometrium, to assess for any irregular features. If necessary, a biopsy will be taken from the lining of the womb. This is called a Papille biopsy. If this is not possible, you may be offered a hysteroscopy. This is where a small camera is passed through the cervix and into the womb. It allows your nurse or doctor to view the endometrium and take biopsies where necessary. Grading. The biopsy will determine the grading of your cancer. Grading is about how the cancer cells look under the microscope compared with normal cells. The grade helps your doctor to decide upon your treatment. If a low grade, grade 1 to 2, is suspected, then your treatment will be offered locally at South Sunderland Royal Hospital. If the biopsy has a high-grade features, you'll be referred to our regional gynecological centre, currently based at the Queen Elizabeth Hospital, Gateshead. All ladies with a confirmed cancer will need to be discussed at our regional MDT meeting. Staging of womb cancer. The stage of the womb cancer describes how the cancer has grown, if it has spread from where it has started. Knowing the stage of the cancer is important. It affects the decision you and your doctor will make about your treatment. The exact stage of your cancer is usually confirmed after surgery if you have this. Treatment for womb cancer. This will be determined upon your general health, the type and size of the tumour, whether the cancer has begun to spread. Most women are offered surgical treatment for endometrial cancer. This would entail having at least a hysterectomy and a bilateral salpingo oophorectomy, removal of your tubes and ovaries. After surgery, the stage of the cancer can be determined. This will decide if you require additional treatment in the form of normally radiotherapy but occasionally chemotherapy. You will need a CT scan after surgery if this is the case. Sometimes it is not possible to have treatment to cure endometrial cancer. However, treatment can still be given to shrink and control the cancer and to relieve symptoms. If you are not suitable for surgery, then treatment may be offered in the form of hormones to relieve symptoms or radiotherapy only to control heavy bleeding. What happens next? After completion of your treatment, you will be seen by your clinical nurse specialist who will discuss the next steps with you. This may entail regular review appointments. However, some ladies opt not to attend for follow-up and instead they are asked to contact their nurse specialist if they have any new symptoms that they are worried about. What additional support is available? Additional online support can be accessed via Macmillan online website or the Eve Appeal, a site that looks at all gynae cancers. Of course, you can contact myself or Robin, your clinical nurse specialist.